right, Dr. James is here. Perfect. All right. Let's see. So he's one of the most interesting men I know, really. He's Dr. James, he knows a lot. I'm trying to see if he can figure out to join me here. He's coming. He's on his way. And a little background about him. He does everything. He's an entrepreneur. He's a philanthropist. He's a minister. He has his own church. Doc, what's going on, sir?
Hey, Dr. E, how are you?
You found me. There you
I
are.
found
Good.
you.
It took a minute. We got it.
It took me a minute, but I found you. Yes.
Sir. Are you at your office still?
I'm in my office.
Oh my God, that's right. See, you guys, he's a minister. You got to work on Sundays. Church is on Sundays. You don't take a day off. You just can't. You can't take a day off. There's no stopping the string.
Yeah.
Good. So let me see if I can put up. I wrote a little something, but if I wrote it here, can I? I've never. Let me see. Pin it down. Okay, here we go. Good. I put a little, corner of your bio here. I know you're. Let me see. Can you see me, Doc?
I can't see you.
You cannot see me. Let me see. What did I just do to myself? I don't know what I did for myself. Anybody can write down.
But but you did pin it up. It's pinned up.
I did pin it, but I went ahead and ruined it at the same time. So let's see. Well, that's a different color. That's definitely not me. What did I do? Switch.
There you go.
Okay, interesting. I might have. I think I pressed flip somehow. I don't know how I put it. All right. So here we go. So Doc, I know we got the ministry going. You got your clinic going. You got your psychotherapist. Your entrepreneur, philanthropist, and educator, professor, vice chair of a university. I don't even know. You have so many titles. You have so many clinics. Virginia, D.C., Maryland. Tell me a little bit about your background. Introduce yourself to the audience here.
So, hey, I'm Dr. James, and I am glad to be here with Dr. E, as we call him. So my background works with first undergrad, which is an interdisciplinary degree from Catholic University. So I'm cross-trained and multidisciplined. So that means this. So when I got to graduate school, so I started out with a master's in divinity and also a PhD in the integration of theology and psychology with a integrative medicine added to that. And then a master's in counseling program and then a doctor of ministry. Which added neurotheology, neuroscience, and mind-body health and healing. And so I got started early with pre and post internship programs where I was able to work with primary care doctors, cardiologists, and then other specialties. And so as I took on the position in the clinic, and became a therapist there in the clinic in Maryland and also in DC, the Washington Hospital Center, cardiologist center, kind of got excited about the work that we were doing in terms of integration, especially when it came to lifestyle interventions, helping people through their serious illness conditions, doing mind and body together. So they started sending me cardiology patients.
Wow.
That we had to do lifestyle intervention with. So that's where the exercise comes in at.
Oh, I see what you mean.
So the exercise and the rehab came in because we realized that what they needed to do was, one, is learn how to eat healthy. They had to change their lifestyle. We had to deal with the depression, the anxiety that came along with their illness, with the cardiovascular problems. But they also needed a lifestyle change. So they needed to be able to work out, and they wouldn't work out. And that was a problem. Once they left this level 1, level 2, level 3. So in terms of cardiovascular rehab, 1 and 2 is done in the hospital. Okay. 3 can be done outside of the hospital. So that's where we came in at. And so we started doing level 3, level 4 cardiovascular rehab. And so in doing that, level 3, you're still under the guidance, of course, of a physician. Level 4, you're on your own.
Wow.
And so we developed this program. And so we started doing rehab, and then people started sending me more patients with other problems.
Wow.
Like they started having respiratory problems. People came in with other kinds of issues. And so we added exercise, we added nutrition with it. And then we met you.
Wow. Right. So the story
And
goes,
what we were looking for was a chiropractor who also was certified or licensed also in terms of exercise. And then I guess a better term to put that is, what was your other specialty, doc?
Physical therapy.
Physical therapy.
Yeah, physical medicine.
Physical medicine,
Rehab.
physical therapy.
Yeah.
And so we met you, and what we tried to do was integrate chiropractic with mental health, and then chiropractic with, of course, with neuroscience.
Right.
So neuroscience talks about how the brain actually works in the nervous system.
Right.
So that's a specialty of mine.
Wow.
The brain and the nervous system, how those things work. When we talk about biomedical, we talk about pathologies as it relates to diseases, Alzheimer's, other kinds of diseases that comes into play. And so being able to work with that, because primary care started sending me patients who had these kinds of problems. Right. And so we had to major in that. And so what we did is an uptake in our education. And so I started getting certifications in exercise therapy, in biomedical, in neuroscience. And so we went on and got those other things, and then we added it all together.
Wow. Okay. So let me ask you a couple of things about that.
Okay.
You know, you mentioned the from a psychotherapist, neuropsychotherapist, and things like that. Right now, with what's going on, what I've noticed on my clinic is people are just mentally drained from just staying at home. Yeah. And they're depressed, they're upset, they're angry, they're watching TV, they're watching news, they're watching social media. They're just getting ramped up. I had a patient yesterday tell me, I'm just sick of it. I've never felt worse. I'm mentally drained. I'm upset. I'm angry. How do you suggest people deal with that, and what should they do, and what's going on? What do you take?
So there's a couple of things. Deep breathing does a couple of things for people. It reboots your brain, first of all. It clears, it massages your inner organs. It calms you down. It brings a point of helping you with anxiety, because that's exactly what they're talking about, is anxiety. Also, my suggestion is home exercises. Right. So deep breathing with home exercises, it could be a brisk walk. It could be jumping jacks added to it. It could be a number of those things that they do that kind of helps their body and their brain kind of balance itself out, because that's what's going on with them right now. So even though you can't, let's say you're in the house, you can't go to work, go outside and do some exercise outside. Do deep breathing and some exercises in your backyard, on your front stoop. Take a walk around the neighborhood. And when you're in the house, we're going to add some nutrition to that. Things that you should be eating. Make sure you're eating lots of fruits, lots of vegetables. So let me stop
you right there, Doc, because nutrition is the next thing I want to ask you about. But as far as breathing goes, what do you suggest? What kind of breathing? How long to breathe for? How many times? How many times a day? What's reps? What sets? What do you suggest?
All right. So what we want to do is we're going to breathe from our diaphragm for them. That's what I want them to do. Diaphragmic breathing. So I want you to breathe. All right. I want you to take it in. All right. You're going to hold it 3 seconds. I want you to let it out. Right. And I want you to do that, because when you start doing that, if you ever notice that when you're yawning, let's say if you take a yawn, right, your hearing and all that is affected by that.
You almost made me yawn, Doc.
Yeah.
I'm thinking about it. Like, I should yawn, but it looks bad. I don't know.
You'll actually ask somebody, what did they say? Because it affected everything. Yeah. So from your breath, from the breath of an individual, they can recover from a lot of situations.
Wow.
When a woman is having a baby and she's in pain, what do they tell her to do? Breathe.
Just breathe, right?
They tell her to breathe. So breathing can help with pain. Breathing can help with rebooting the brain.
Mm.
So that deep diaphragmatic breathing that they would do, hold it for 3 seconds and then letting it out, they
Yeah.
would feel a lot better.
I see. So hold it for 3 seconds, let it out. And would you say like a few times in the morning, a few times at night? Is there a specific amount or
I
just
would say
whatever?
in the morning, get up and stretch in the morning. Stretching is
Uh-huh.
also
Uh-huh.
another thing to add to that. So when you're
Yeah.
stretching, add deep breathing to their stretching
Okay. Got you. Got you.
in the morning. And then in the afternoons, you want to do it 3 times a day. So in the afternoon, you want to be able to get a little workout in the afternoon. And so you want to add deep breathing to it. Now, and make sure that before you go to bed, about an hour before you go to bed, you could do things like read, you could do reading, and then you can do deep breathing, and by that time you will want to go to sleep.
Okay. So let me ask you this now. Now, some people are shy of going to psychologists and psychiatrists and or any sort of like mental therapists. They're shy of, or they're scared of, or they don't know, or they just don't want to be the stigma. They feel like there's a stigma with it. How do you, what do you tell those people that have that kind of mentality about being shy about these things?
Well, only healthy people go to psychiatrists or counselors, to really be honest
Mm,
with you. That's the
mm-hmm.
first thing to understand, is that it's not that you're ill. When you're ill, you don't want to.
I see.
When you're healthy, you want to go. And what you want to do is you want that feedback. You want someone to listen to you, and you want to be able to get that feedback that
That was
balances
real
you out. So
powerful,
what I
man.
would tell them to do
Uh-huh.
is to look at it more as a balance,
Uh,
having a balanced life,
I
right?
see.
You cannot have pain, chronic illness, and not have a mental problem with it, like anxiety or
Wow.
depression, because now you have a lifestyle change. You
Right.
can't do the things that you used to do. So you've got to use what is called mind-body medicine. Energy medicine, again, is powerful as well. You use energy medicine when you use TENS. When you use
Uh,
the TENS machine, that's energy medicine, right?
right.
So when we use polarity therapy, that's energy medicine. We just mix polarity